Hey guys, so it is 4 in the morning right now, and I started having vaginal bleeding about an hour ago. I'm in the hospital right now. They still have to see me and everything, so I don't know exactly what's going on. But I just wanted to let y'all know, and I'll keep y'all updated, guys, onto what happens or what they say. I'm having a lot of cramping just in my whole abdominal area, so I don't really know what's going on, guys. But anyways, as soon as I find something out, I will let y'all know. Hey guys, so the doctor just came in and he said that it is ectopic, but it's on my right side, and I'm just so confused because I don't even know how that's possible. My right tube isn't even untied. I don't know, guys. I'm gonna let y'all know what they say because the OB on call is gonna come in and talk to me, so I will keep y'all updated on what happens. I'll be back, guys. Hey guys, so last night I ended up having emergency surgery to my right tube because that's where the baby was, and the OBGYN on call said that my tube was like rupturing and I was starting to bleed out, and that's why I was having those pains and just not feeling good. So everything happened so quick, you guys. I had to go have surgery real fast. I couldn't even really tell my better half or anything what was going on, but I'm here this morning and I feel so much better, you guys. I'm not in any pain besides that big gas bubble that's in my body that hurts for them to do the surgery. But I'm feeling a lot better. I'm still here in the hospital. I should get discharged at 2. You should want me to go home and rest. Hold on, guys. My mouth's a little dry. They want me to go home and rest. So yeah, guys, I'm just trying not to be emotional. I was so emotional last night. I could not stop crying. I was like crying right before they put me to sleep. But everyone here was so good and so sweet to me and so understanding. Even the nurse, she's being so good to me, guys. She's taking such good care of me. I was throwing up my brains when I first got up from surgery, and she was just wiping my mouth and holding my hair back, and they're so good here, guys. But anyways, so that's pretty much what's going on, you guys. Like I was telling my mom last night when I started having, because what started it all, guys, was it was about 3 in the morning. And I woke up because I felt like a little bit of pain, not even a lot, guys. It felt like just like a period cramp pain. But I felt like something felt kind of wet down there, so I went to the restroom, and when I was peeing, I wiped myself. I looked and I saw blood, but it was pink, so it was like almost like spotting. So that's when I was like, no, something's not right. I need to go in. So the only thing that really brought me into the ER last night, guys, was the fact that I was spotting, not even because of the pain. So had I not come in because of the pain, guys, had I not come in because of the spotting, I think like I would have been at home when my tube ruptured, because like they said, they were like, it was already like tearing. So yeah, guys, I'm really upset. I'm still really upset. And then, guys, on top of all that, they do a COVID swab and they tell me I test positive for COVID. So now I'm here in isolation. I can't have anyone in here with me. Honestly, guys, I have no symptoms at all. But in June, I did test positive for COVID. I came into contact with a patient who had it. Or no, I didn't come in. My coworker came into contact with a patient who had it. I came into contact with my coworker, and that's how my whole office ended up getting it. But we're all the way here in August, and I don't have any symptoms, or I'm not sick or anything, and it's crazy, and I just feel so bad because I didn't know. Had I known I had COVID, I would have told these people, But anyways, I've been wearing my mask. I don't have it on right now, but I've been wearing my mask and stuff like that. Anyways, guys, I just want to give y'all a quick little update on what's going on. I really appreciate y'all being here for me and supporting me through this time. I'm going to go ahead and get a little rest before I get discharged, and then I will see y'all back. Hey guys, so sorry if my throat sounds just a little bit raspy. It's still kind of sore for when they put the tube down there for the surgery. So it's the next morning after surgery. I had surgery yesterday around 4 in the morning, I would say. And I'm in a lot of pain, guys. Like they have to blow your body up with like gas, I guess, to do the surgery. And that gas bubble hurts because it's like it travels, it goes into your chest, into your shoulders, It's just really painful, guys. It hurts a lot. And then of course it's like really sore down there, my abdominal area, because of all the incisions. So it's kind of making it like a little hard to breathe sometimes, just because it hurts. So, you know, I did have that done with my tubal reversal. They pumped me with gas, but when they did that, guys, I was in the hospital for like 3 days, and they had me on a morphine drip the whole time. So I was kind of in and out of, like, you know, like awake consciousness and awake into sleep. You know, I was kind of back and forth. So I felt pain at that time, but just, I guess I didn't feel the whole pain, and the gas bubble had already, like, was going away by the time I went home. So this time, you know, they didn't give me any, they only gave me like tramadol. So I kind of like feel everything still, you know, guys. But anyways, so I just wanted to let y'all know that I'm doing a lot better. My mom has both of my children right now. You know, she kept them for the night and stuff, and she's watching them. My better half's been awesome about this whole thing. He's been taking very, very good care of me. I feel bad because this, guys, this all happened, you know, like in the morning, right? Like I woke up and it just started happening, and it was his birthday, and we were supposed to go out of town to go see his sister. Sorry, guys, it hurts, for his birthday, but all this happened, and I just felt kind of bad, but but he understands. I mean, it's okay, guys. There's always gonna be more birthdays, and I only have one life, so I'm glad I went in there. You know what I mean, and got checked out and everything like that, guys. So it was really scary, guys. Like I said, when everything happened, like from the time I had my ultrasound to the time they wheeled me back into the room, it was like maybe 20 to 30 minutes at tops, and the doctor rushes in. All these nurses are coming in, and they're like, okay, this is what's happening, you need to go into surgery now. You know, like I mean, they were just on it. They were on it, and I couldn't even have time to process everything. I was just like what? Like, one doctor went in and told me initially what was going on, and he was like, the OB's coming in, and then, like, you know, like 10 minutes later she came in, and that's when all that stuff happened. So that was what happened, guys. They were really efficient. They worked fast, you know. And then the OB told me, she's like, as you can see, you know, when it comes to ectopic pregnancies, like, we don't play around here. Like, if we feel like the tube is rupturing or has ruptured, we're going into surgery now. Like, we're not waiting. So they were like on it quick. I didn't even have time to really text my mom or my significant other to tell them what was going on, because when I came to the hospital, I came by myself, because I told him, you know, he was like, let me drive you. I was like, no, stay home. You know, me being hard-headed that I am, I was like, stay home, it's gonna be fine, like, it's probably nothing, you know. Just, I wasn't even thinking that was gonna happen, because that, I didn't even think that. And so he stayed home. I was fine driving over there and everything like that, you know, parked my car in the ER parking, and then that's when all that stuff happened. So I didn't have anybody there with me. So I texted them, and I only texted them like the bare minimum, like, I'm going to emergency surgery, I don't know what's going to happen, call the hospital. Right, that's all I could tell them, because they were like, turn your phone off, we need to go now. So I turned my phone off, I'm giving them my jewelry, you know, taking all my piercings out and all that stuff. And they're putting the little booties on my feet, putting that like head cover on my head, taking me in. And then I talked to anesthesiologists. They're looking at my teeth, looking at my throat, you know, going over all the stuff. They do the COVID test, which y'all saw came out positive, which I told y'all came out positive. I had no idea I had it, guys. Anyway, so they do all that, and then you know, that whole time, guys, I'm like bawling my eyes out. One, I'm just trying to process that I'm losing my child again, and two, I'm freaking scared, because I'm going into emergency surgery, and you hear about, you know, you read about and you hear about these ladies that like die, you know, and it's scary. And I didn't even get to kiss my kids goodbye, nothing, you know. I was like scared. I had so much going through my mind. So I was like, they're just crying. And they were so good to me, guys. Like, they knew I had nobody there with me, so they were just comforting me. They were taking such good care of me. Like, they really cared for me there. They weren't being like ugly or anything like that. Even in recovery, guys, when after the fact, when they found out I had COVID, instead of just being like, oh, like, you know, I need to stay away from her, they took really good care of me. Yes, they were all PPD. They had they were covered, they were protected, you know, every time they were in the room with me. And I was in an isolated part of the maternity ward, so they took really good care of me, guys. Like, they went in, I was throwing up so bad after, when I woke up. And the nurse, she didn't even hesitate. She put my hair back. She was wiping my mouth, wiping all my throw up. She was helping me put my panties on, like, in the pad, and I was bleeding, you know. Like, she didn't hesitate at all. And she told me, she's like, I think it's just the grandma in me. Like, you know, and I know you don't have anyone here, so I just want to take really good care of you guys. Take really good care of you. So yeah, guys, it was scary, but I'm so grateful that the staff was there to help me and to take care of me when I had nobody there with me, guys. Oh, this gas bubble hurts. I'm gonna get up and show. Let me try to see if I can show you all my incisions. Hold on a second. Alright, guys. So my bathroom is not clean right now, guys. I'm telling y'all, we were supposed to go out of town. I was gonna make a whole nother video for y'all. I was gonna make like a go out of town with me. Let's get my mind off everything, because you know, guys, like I told you, I still didn't really know what was going on at that point. And then all this happened. So this is how it looked, guys. Keep in mind, I'm still really bloated, guys, from all that gas, and I'm like kind of bruising a little bit, I can see. But I want y'all to see how it looks, because I'm pretty sure some of y'all are curious. You know, I would be curious too if I've never had an ectopic, or I've never had this kind of surgery, or maybe I might be going through it and I want to see how it looks. So this is how it looks, guys. So they made 4 incisions, one right here, there, above my belly button, here, and they did go in through my vagina as well. Yeah, guys, so it's starting to bruise. You know, you can see the bruising there. You can see the bruising all around here. I do have a belly button ring that I put in here, and you can't see all the stretch marks. I got this really big stretch mark on my belly button from both of my kids, my pregnancies. Yeah, guys, but that's it. That's how it looks. And then it's just like a lot of cramping all right here, guys. It just hurts. It's so swollen, and it's like hard to the touch, you guys. Like, it's really hard. It's not like sinking in like chubby or anything. It's just like, it's a little softer down here, and it's just like hard up here. Anyways, guys, that's how it looks. And then at the hospital, they gave me this like little wrap thing, and it's kind of like when you have a baby. Like, I know I've gotten it before with my youngest one. I don't remember getting it with my oldest, but when I had my youngest, they gave me that after I gave birth, to kind of like help, I guess, like hold in my stomach or support it. And they did the same thing with this one, because I have the gas bubble, and that really helps like kind of like keep the compression on it. It feels really good, guys, because this gas bubble is no joke. It freaking hurts so bad, guys. Like, I didn't know I had it until the nurse went in there and she was telling me you have it, but I was still kind of a little loopy, and she was like, you know, you have a gas bubble in you. I'm sorry, guys, I've been belching and passing gas, like it's just trying to come out. She's like, you have a gas bubble, it's really painful, don't freak out or anything like that. And I remember feeling all this pain in my stomach, and I think that's where the gas bubble was at first. And when I kind of sat up, it moved up like into my chest, like my diaphragm or something. Like, I can't even explain it. It was just in my chest, guys, and I could not breathe. Like, it was like, it felt like someone was sitting on my chest, and I was telling her, I was like, I can't breathe. And then I think I kind of started freaking out a little bit on top of all that. So she was like, roll over, and she rolls me over, and as soon as she did, I swear, guys, I felt that bubble kind of like move over into my shoulder and everything. And yeah, it hurt like heck, but I could breathe. I was like, so it's really weird, guys. Like, if I lay flat on my back, like, I just can't. Like, guys, it goes into my chest and I can't breathe. So if I'm at least elevated with a couple of pillows behind me, it goes into like my arms, like up here, and it feels a little bit, it still hurts, but I can breathe and get sleep. Sometimes I can even lay on like my left side, but then it fully goes over to this side and like in my ribs, and it hurts. It hurts a lot, guys. But anyways, yeah, guys, I'm just really blessed to still be here. Like, thank God, you know, I'm still really emotional. I think we both are still very emotional about losing our baby. We are. But from what my doctor tells me, it could have been a lot worse. Like, had I gone in any later, like, I would have been bleeding a whole lot more. Like, I guess it just tore and started to bleed when I was going in. So I went in like at that perfect time, I guess you could call it. Anyways, guys, so yeah, that's what happened. Like I said, I'm just thanking God, honestly, that I'm here right now. And you know, guys, if y'all feel like something is happening, you know, y'all definitely go to the ER. Just don't wait, go. Oh, guys, and something I want to talk to you about. So when they came in, they were like, yeah, it's ectopic. Oh, sorry, guys, it's ectopic, and the baby's in your right tube. Guys, I thought I was hearing stuff, okay? I thought I was like, maybe I was in so much shock I didn't hear something right, you know? And I was like, my right tube, what? And that was just the ER doctor, okay? So when the OB went in and when everything started moving all fast, she was like, it's in your right tube. I mean, it's in your tube, whatever. And I was like, well, he told me it was in my right tube. And she was like, let me double check. I'm going to check when I go in there. And I was like, okay. She's like, but if it is in your right tube, like what's going on? Tell me like your prior surgery. So I told her, you know, when I had my tubes untied and I had the reversal, which I'll put my link down below so y'all can watch that video if y'all want to see it. When I had them untied, the OB who untied them said that my right tube was too badly damaged when it was cauterized. So they didn't untie it. They just left it, you know, free flowing around in there. But my left tube, they were able to save. They untied it and all that stuff. And that's how I've been able to get pregnant. You know, my last 2 pregnancies was from my left tube. So, yeah, so guys, come to find out, I was pregnant with this pregnancy. The baby was somehow found its way into my right tube. I don't even know how that happened, guys. I had my tubes tied for years. Me and my better half had so much unprotected sex, and that's never happened to me. So somehow that baby found its way into my right tube, and they ended up, you know, of course, taking my baby, and they took my whole right. She was like, while I was in there, I went ahead and just took the whole right tube out because, I mean, there was no fixing it anyways, and to prevent, you know, future ectopics. So she took it all out, and while she was in there, she went ahead and cleaned up the scar tissue that was on my left side. So she went in there, cleaned it all up. She's like, you had some scarring on your ovaries, and I cleaned that up. So she was like, if y'all want to try again in the future, you know, y'all can. But, you know, of course, they highly recommend we do IVF. So, yeah, guys, that's all what happened. So I'm just at home relaxing now, and just really blessed to be here right now. My better half is getting us some breakfast right now, and then probably ask my mom to bring the kids by later because I know everyone was just kind of worried about what was going on. But anyways, guys, I am going to head out. I'm going to go back and lay down and relax for a little bit and try to get comfortable with this air bubble floating around everywhere. So I will see y'all in the next video, guys. Bye.